everyone, this video is part 3 of the 5A series for AP Psychology students. This particular video will cover identifying the causes and symptoms of schizophrenia spectrum disorders. As you can see in the unit outline, we are still in that section called Selection of Categories of Psychological Disorders. And as you already know, there are many categories within the Diagnostic and Statistical Manual of Mental Disorders, and we are focusing on a select few. Today's video will focus on the category called schizophrenia spectrum disorders. This is the key theme for today's video. While you're watching, you should take note of the symptoms and possible causes of schizophrenia spectrum disorders. Here's a list of our vocabulary concepts for today's video. While you're taking notes, make sure that you're able to define and describe each one of them. Schizophrenia spectrum disorders are a group of severe mental health conditions that affect thinking, perception, emotions, and behavior. While symptoms vary, they all involve distortions of reality, problems with organized thinking, and difficulty functioning in everyday life. All disorders within this spectrum share key features that I will explain more in this video, but they are hallucinations, delusions, disorganized speech or behavior, and impaired emotional expression. Some individuals experience episodes of psychosis, and psychosis refers to a loss of touch with reality, making it difficult to distinguish between what is real and what is not. For this course, we will focus on schizophrenia, though other disorders also fall within this category, like schizophreniform disorder, schizoaffective disorder, brief psychotic disorder, and delusional disorder. Schizophrenia is the most well-known of the schizophrenia spectrum disorders, but it is relatively rare, affecting about 1% of the population. Schizophrenia is a severe mental health condition. If you break the word apart, schizo means to split, and phrenia means the mind. But this is where a very common misconception occurs. People often misunderstand this for having split personalities, and that is not what schizophrenia is. Schizophrenia is a split from reality and losing touch with what's real and what's not. It's also important to know that untreated psychosis sometimes leads to unpredictable behavior, but that does not mean violence. In fact, people with schizophrenia are more likely to withdraw from others, and they're more likely to be victims of violence than perpetrators. Schizophrenia is diagnosed when a person experiences at least 2 of the following 6 symptoms: delusions, hallucinations, disorganized speech, disorganized motor behavior, and negative symptoms. At least one of the 2 symptoms must be delusions, hallucinations, or disorganized speech. Schizophrenia can also be acute or chronic. Acute schizophrenia develops suddenly. It's triggered by stress or trauma, and people with acute schizophrenia often respond very well to treatment. Chronic schizophrenia develops gradually over time, with symptoms worsening and lasting long term, making treatment more challenging. Now, let's go a little bit deeper into each one of those symptoms. Schizophrenia has both positive and negative symptoms. This does not mean that they are good or bad, but it refers to whether something atypical has been added, which would be a positive symptom, or whether something expected has been taken away, which is a negative symptom. Let's start with positive symptoms. These are behaviors or thoughts that are not typically present in a healthy person. One of the most prominent positive symptoms in people with schizophrenia is delusions. And delusions are false beliefs that have no basis in reality and persist despite evidence to the contrary. And there are 2 types of delusions. The first is delusions of persecution, and these are false beliefs that others are out to get them, that they're being monitored or followed or plotted against or spied on or targeted for harm. They might falsely believe that someone is tapping their phone or listening to conversations through different devices, following them in the street, tracking their locations, or trying to poison their food. The second is called delusions of grandeur. This is a false belief that one has special importance or special abilities or power or some kind of significance beyond reality. They might believe that they have fame when they do not, or that they have a power to control something that is completely out of their control, like the weather, or that they have a connection to a powerful person or deity. Delusions can be highly distressing and may lead individuals to act in ways that seem irrational delusional to others, but to them, these beliefs are very real. The next positive or added symptom of schizophrenia is hallucinations. The DSM 5 defines hallucinations as false sensory perceptions that occur without an external stimulus, meaning the person sees, hears, feels, smells, or tastes things that are not actually present. However, these perceptions feel completely real to the person experiencing them, even though others can't see or hear or sense them. The most common type of hallucination is auditory hallucinations. This would be like hearing voices, sounds, or noises that are not actually present. The voices might talk to the person, saying distressing things or giving commands like stand up and run away. They might comment on the person's actions in a critical or threatening way. People with schizophrenia may struggle to recognize that these voices are not real, which can cause distress or lead to behaviors that are based on the hallucinations. Another common hallucination is a visual hallucination, and this would be like seeing people or objects or lights that aren't actually there. This might be like someone seeing a shadowy figure or a flash of light or distorted images or people. And these are positive symptoms called hallucinations. The next symptom is disorganized thinking or speech. These symptoms make it difficult for a person to organize their thoughts, communicate clearly, and respond appropriately in different situations. Because their thoughts might be scattered or disconnected, it can be hard to follow what they're saying. Disorganized thinking and speech usually manifest in two main speech patterns. The one that you need to be familiar with is word salad. Word salad occurs when words are jumbled together in a way that doesn't make logical sense. Their speech may be a random mix of words with no meaningful connection. And I have an example of that in the first speech bubble. The sentence is, "The table jumps in the green purple dance shoes. Tomorrow, waiting, and the sky will fly." In this example, the words don't connect in any clear or logical way, making it difficult to understand. Another example of disorganized thinking and speech is through what's called loose associations. Loose associations happen when a person's thoughts move from one topic to another in an illogical way. While there still might be connections between the ideas, it's difficult to follow and it often feels disconnected. That's the second example on the screen. That sentence says, "I went to the store to buy some bread. I like to bake, and my sister is always cooking. Did you know that bread is a type of cake? I love cake." In this example, the speaker moves from talking about bread and baking and then shifts to cakes, which doesn't necessarily make a clear connection, but it is somehow connected to an original idea. And so this is what is called loose connections. Next is disorganized motor behavior, which refers to abnormal movements or behaviors that interfere with the person's ability to function normally. These behaviors can manifest as either positive, meaning they are added, or negative, meaning something has been removed or a typical behavior has decreased. Catatonia is a state in which disordered movement can be presented in different forms. There's catatonic stupor and there's catatonic excitement. Catatonic stupor is a negative behavior symptom. In catatonic stupor, a person becomes immobile and unresponsive, showing little to no reaction to external stimuli. This might include sitting in one position for a very long time, unable to engage in activities, whether that's eating or speaking or moving. A person may remain motionless, staring blankly and unresponsive to touch or conversations, and this state can last for hours or days without apparent distress. The second is called catatonic excitement, and this is a positive symptom and it involves excessive movement and agitation. People in this state may display repetitive actions, extreme restlessness or erratic movement, like pacing or shouting, or making rapid, uncontrolled gestures. Their behavior may seem disconnected from the situation or their surroundings. Additional disorganized motor behaviors include posturing, which is holding and maintaining an unusual or uncomfortable position for an extended period of time, like standing with arms raised. Or what's called waxy flexibility, when a person's limbs are moved by someone else and then they can maintain and remain in that position as though their muscles have been stiffened. These motor behaviors indicate a disruption in the brain's ability to regulate movement and behavior, and their severity can vary depending on individuals with schizophrenia. So, as you now know, negative symptoms refer to a reduction or a loss in normal functioning or behaviors. They reflect a decrease or an absence in things that are typically present in a person's healthy and normal expected behavior, emotions, and abilities. On the last slide, I mentioned catatonic stupor, which is a negative symptom, and I'll go ahead and explain a few others. Flat affect is a severe reduction in emotional expression. Individuals with flat affect may appear emotionally unresponsive, even in situations where others would typically show emotion. They often lack facial expression, like smiling or frowning. They lack the gestures and the voice tone that you would typically see in someone who is expressing normal emotion. An example might be a person might discuss something sad or exciting with no change in tone, showing no facial change or expression, and little reaction to emotional events. Another negative symptom is lack of self care, and this would be a noticeable decline in personal hygiene, grooming, and daily activities that are important for overall health and well being. This would look like someone who isn't carrying out just daily tasks like brushing teeth or combing your hair. A person might wear the same clothes for days or forget to shower. They might neglect eating or even sleeping regularly. And these symptoms are not intentional, but stem from cognitive and emotional disruptions that are caused by schizophrenia. The exact causes of schizophrenia aren't fully understood, but research suggests that a combination of genetic, biological, and environmental factors contribute to its development. As far as genetic factors go, schizophrenia tends to run in families, indicating there is a genetic link. People who have a close family member, like a parent or a sibling, who have schizophrenia are at a higher risk of developing schizophrenia. Twin studies show that identical twins who share 100% of their genes have a higher likelihood of both developing schizophrenia compared to fraternal twins. However, even in identical twins, the risk isn't 100%, showing that genetics alone aren't enough to cause schizophrenia. The second is prenatal virus exposure. Research suggests viral infections during pregnancy, especially in the second trimester, may increase the likelihood of the child developing schizophrenia. This exposure could disrupt brain development, contributing to the onset of the disorder later in life. Environmental factors like maternal nutrition and stress or exposure to toxins during that prenatal development may also play a risk in the development of schizophrenia. The third is neurotransmitter imbalances. This is called the dopamine hypothesis. The dopamine hypothesis suggests an imbalance in dopamine, which is a key neurotransmitter that is believed to contribute to schizophrenia. Overactivity of dopamine in the neural pathway, which regulates emotions and perceptions, may lead to the positive symptoms like delusions and hallucinations. Conversely, reduced dopamine activity in the prefrontal cortex is associated with negative symptoms that cause things like flat affect and lack of emotion. Schizophrenia is likely caused by a complex interaction of genetic, biological, and environmental factors. And with ongoing research aimed at better understanding these relationships, psychologists are hopeful that they will know more in the future about the causes of schizophrenia. Let's finish today's video with a few short questions for review. Just remember that I'll read the question but not the answer, so you'll need to pause the video to determine which is the correct response. Question number 1 says, a therapist meets with a patient who believes that they have the ability to control the weather with their thoughts. The patient frequently mentions being able to influence global events and thinks they're being watched by a secret organization that wants to use their powers. Which of the following best describes the patient's belief? Question number 2 says, a person with schizophrenia has been sitting in one spot for hours, staring at nothing and not responding to anyone. They do not move, even when someone tries to engage them. What symptom is this person most likely experiencing? Question number 3 says, which of the following is a negative symptom of schizophrenia? This concludes today's video on schizophrenia-related disorders. On the left-hand side of the screen, you can check your answers to the multiple choice questions. And to make sure you're taking away the most important points from today's video, you can go through and check our key concepts and our major focus question.